According to the American Cancer Society, approximately 1 in 8 women will be diagnosed with breast cancer in their lifetime. And this month of October is dedicated to breast cancer awareness. So joining us today is Dr. James Coley, an oncologist with Novant Health, talking about a multidisciplinary approach when it comes to treating those breast cancer patients. So thank you so much. Appreciate you coming in today.
Thank you. Thank you for having us today.
Let's talk about exactly, what that means, multidisciplinary. So it's a whole team of doctors.
Yeah, so multidisciplinary tumor board is basically a fancy way of saying everyone kind of has a seat at the table. Breast cancer is the ultimate team sport in that we have multiple providers, right? We have medical oncologists, as myself, who manage chemotherapy if it's indicated, hormonal therapies. We have the breast surgical oncologists who manage surgery and perform those surgeries. We have the radiation oncologists who deliver radiation if that's indicated. And then even outside of physicians, right? We can't do our job without our nurse navigators, our nursing team in the clinic, our social workers, and even our pathologists. So it is a true team sport in breast oncology, and which is why it's very rewarding to treat.
Right, so a patient basically with the diagnosis knows that several people are looking at her case and then deciding exactly what to do, how to treat, then also the recovery period as well. So it really is it's a good option, or it's a good practice for the patients. I'm sure it makes them feel, a little bit better about everything.
For sure. I think most patients, it is already an overwhelming diagnosis. So I think comes with that understandable fear and a lot of questions. And to hear those questions answered ultimately by multiple providers, I think provides some comfort because we work in lockstep together. And we sequence our treatments based on those discussions. And so multidisciplinary tumor board is not just with breast cancer, it's with a host of other cancers, lung cancer, GI cancers, but the kind of model for it actually kind of really grew with breast cancer care.
And let's talk about some of the latest advancements in breast cancer diagnosis and treatment.
So breast cancer in all cancer is growing by the day, right? We have personalized treatment decisions based on, do women benefit from chemotherapy or not? We have specialized tests for that. We have specialized testing to see how long, if you need hormonal therapy, how long you should be on that therapy. And then we even have surveillance genetic testing, meaning actually using the tumor itself and taking that biology and following you for years and years just with a blood test. And so those things are what we have now, and in 5 years we will have probably several other things. And so it's
continuing the advancements and learning and educating yourselves as well.
Yes. It's a blessing and a curse, but we have to be up to date on a weekly and monthly basis because things change as we get new approvals and new research kind of reads out.
Of course, and as always, remember, a lot of this can start with you at home by doing those self-breast exams. Thank you so much for coming in and sharing that information.
Thank you for having us.